So I think surgery is very much an iterative, cumulative acquisition of skills. And when you begin surgery, you don't know how to hold a pair of needle drivers and you don't know how to tie a knot. It's very appropriate that you learn to do that on a silicone pad. And then the next challenge after that becomes how to adjust that suture tension appropriately to the tissue that it's being placed in. And then a silicone pad no longer works and you need something that simulates tissue. And then the next challenge after that becomes how do I do those things while working down and inside with another piece of bowel, trying to flop on top of a piece of bowel I'm working on. And then to learn that skill set, you need an actual full dog. And then the final part of it becomes how do I learn to do that with a patient that's breathing and moving and bleeding, where I feel the pressure of emotional responsibility to the patient and the owner to perform optimally. And for that, you then need a live patient. And so you go through this process of silicone pad to isolated piece of bowel to simulator unit to patient. You would never think that your entire surgical training could be accomplished on a silicone pad, but you would never begin with the live patient. So the students are assigned in pairs to a cadaver unit, and they each alternate performing different components of the procedure. They gown and glove, they drape in just as they would for a live animal. They have the same instrument set up and suction and lighting and table that they would have for a live patient. And then our focus during the lab is to teach them gentle tissue handling, efficiency in their use of instruments, how to maintain a flow of productivity through the procedure and not get bogged down in unnecessary snarls, and safety, how to maintain a sterile field, how to manipulate tissue so they can maintain good visualization. And it's those core skills which they can then take on and apply to pretty much any other procedure that they try and do in the future, but which are impossible to teach in a didactic setting. I think really the SynDaver Lab accomplishes multiple facets or multiple goals. One is to try and remove students' natural fear of surgery. It's very hard to behave with good competency and calmness when you feel stressed or afraid. The second is to encourage an enthusiasm for the procedures and for surgery in general, and encourage them in the idea that your surgical training is an iterative process. You acquire a skill, you practice it, you discover that you need another skill, you go learn it, you practice that. You constantly improve, and that's a lifelong career commitment. And the third is to give them a basic skill set which will translate into any surgical procedure that they undertake.